All right, so we'll begin now. Just so everyone knows, this meeting is being recorded. Please keep your speakers or audio on mute until it's time to introduce yourselves. Welcome everyone to our January meeting, the first one of the new year. Thank you all for being here, and I hope you had a great start to your new year so far. I wanted to start with something a little different today. We're going to do a quick icebreaker. I just wanted to start the new year off with a little bang. It's nothing crazy. So I want to know what words you all can make out of the word coalition. So if you could type in the chat box words that you can come up with. And I want to see if you guys can come up with the word I hope you will come up with. I'm seeing nation, that's a good one. No, to, coal, to, ton, it, tail, nice, tone, that's a good one. Lit it on, lion, not. All right, I'm seeing some similar responses. Oh, I just saw the one that I was looking for. Shirley, good job. So action. I was looking for the one action because the hope is that with all this coalition building and the work that we do, we actually put things into action and start making change. So I thought that would be a great way to kind of kick us off. So thank you for your participation. All right. So now we will move right into introductions and sharing. So I will call on every attendee and you'll have the opportunity to briefly introduce yourself. If you have any announcements you'd like to make about your agency or updates, please feel free to do so. If it's a really long one, you could put it in the chat box and I'll make sure that everyone gets sent that after. So I will quickly introduce myself. My name is Melina Rivera. I'm the Tobacco Program Coordinator for Healthy Communities of LaPorte County. And I will go ahead and start from the top of my list here. I see Tammy Garrett.
Well, let me see if I can get myself off of mute.
We can hear you.
Okay, I'm sorry.
No
Glad
problem.
you can hear me. My name is Tammy Garrett. I'm a health partner engagement specialist with CareSource, and I don't have any announcements today, but I look for the opportunity to share with you.
Thank you for being here, Tammy. I see Angie Nelson.
Hello, good morning. Angie Nelson Deitch, and I'm on the City Council here in Michigan City.
Thank you for being here. Chantel Johnson.
Good morning, I'm Chantel Johnson and I'm with Anthem, Blue Cross and Blue Shield. And if anyone knows of any vaccine clinics that Anthem could potentially partner with, please shoot me an email. We would love to collaborate on anything that deals with vaccines. Thank you.
Thank you. I see Tammy Button. Tammy, would you like to introduce yourself? Button? Oh, we will get back to you, Tammy. Jean Ann Cannon?
Yeah, good morning, everyone. It's good to see everyone. Actually, I'm Jean Ann Cannon, the director of Doombrook, and of course, we do the child abuse prevention intervention. Dr. Bunton is who you were talking to, Melina. She is the new director starting in February, actually. I am leaving Dunberg after 7 years. Very sad to leave, but so excited because I'm doing my private practice. I do mostly women's issues and couples counseling. So if anyone needs a therapist, let me know. I've been doing that for years. But Tammy will talk maybe after I and give a little bit of update. She's been with us since January in training. She's going to be a rock star. She's doing great things already. Just to let you know, for anyone needing parenting classes, we have it up and running at LaPorte schools with the pregnant students. It's going really well. If you have at your agency or a church group, anyone, free parenting classes, and we can design it to meet your scheduling needs. And yeah, that's about it, but we're doing really well. And again, Tuesday at 10, Tammy's done a great job of taking over Tuesday at 10. If you want a 10-15-minute interview online, we can do it either Zoom or in person. We do that every Tuesday, and we can highlight you and your program. It's a great opportunity because we give you that snippet for your agency to put on your Facebook page. And tip of the day, you can hold your space bar down and it will take you off mute while you're talking. Your long space bar. It's my little techno tip for the day. It's a beautiful thing. Instead of finding out where's that unmute button, just hit your space bar while you're talking, and then you let go and you're back in gear. And there is a game called Wordle. WORDL, that's just like what you did, Melina. If any of you love that kind of thing, I hate that kind of thing because my brain doesn't work that way, but Wordle's a fun thing. Thank you.
Thank you for sharing. All right, Tammy, do you want to try to introduce yourself again? Dr. Button?
She might be having technical difficulties, Melina.
No worries, no worries. All right, we have Jenny Diaz.
Good morning. My name is Jenny Diaz. I am the community marketing representative for the Northwest region. And no updates as of now, but anyone that might be interested in hearing a presentation of what CareSource does, you can reach out to me. I do have my email address on the chat box, and just let me know and I'll get back to you. Or if you know anyone else that might be interested, you could pass on my information as well. Thank you.
Thank you, Jenny. Juana Ramirez.
Hey, my name is Juana Ramirez. I'm a member connections representative from MHS, another health insurance provider. And I'm currently in the whole state answering questions for members persistent to Health Indiana Plan, Who's Your Health Wise, and if they need or have any other questions regarding our marketplace, Medicare, and Who's Your Care Connect, I can get them, get them connected to the right representative.
Wonderful, thank you. We have Lee Morris.
And the space bar really works well. I'm so glad for that tip. I'm Lee Morris from LaPorte. I'm involved in a lot of different things in the community and just had a strong background for many years in healthcare. So I'm glad to be a part of this group.
Thank you. Liz Pina.
Hi, good morning, everyone. My name is Liz Pina. I am the Outreach and Enrollment Representative with HealthLink in Michigan City. Happy to be here with everybody. Just kind of reminding everyone that we do have those at-home testing kits. If anyone is in need, please feel free to reach out and I'd be happy to coordinate a delivery for your organization. And then we have some things coming up in March that I'll be sharing in the next meeting. So I'm looking forward to that as well.
Awesome, thank you. Mabel.
Hi, everyone. I'm also an outreach enrollment specialist for the corporate office in Valparaiso for HealthLink. And like Liz said, we are offering the COVID kits and we do the COVID vaccines. So if anyone's interested in that, thank you.
Thank you. Miranda.
Hi, everybody. I am also from HealthLink. I am another outreach and enrollment representative based in corporate out in Valparaiso.
Thank you. Moira?
Right. I am. Can you hear me?
Yes.
All right. I am sitting in for Katie Sarber. I'm Maura Cogswell. I am on the Community Programs and Wellness Outreach team here at Northwest Health, and we do not have any updates.
Okay, thank you for being here. Monica? Dumas?
Good morning. I am Monica Dumas from Work One. I am the recruitment manager for Region One. My job is to help job seekers find gainful employment. I was added recently, so I do not have any updates. This will be my first meeting, and I'm excited. Everyone stay warm and safe.
Thank you.
Yeah.
Nakia Bonds? Nakia, would you like to introduce yourself? Okay, we'll move on. We have, Rashana Hood.
Rashana Hood. I'm the enrollment specialist with Healthy Communities of LaPorte County. My main goal is focusing on enrolling members in Hoosier HealthWise, Healthy Indiana Plan, Medicaid, and also Marketplace.
Thank you. And Shirley Du Bois.
Hello, Shirley Du Bois, North Region Program Director for the Indiana Department of Health, Tobacco Prevention Cessation.
Thank you. I think I went through everybody. Is there anybody I missed or wasn't able to speak at the time?
Hi, I'm Tammy Button. I was having difficulties connecting previously,
No problem.
but it's great to be here. And I am the Executive Director-elect for Dunebrook and will be taking over for Jean Ann when she retires here in a couple of weeks. So I'm looking forward to working with all of you and getting to know your programs. Thank you.
Wonderful. Welcome. All right. Thank you all for sharing. I'm so happy to see some new faces and familiar ones. And we will just go right ahead into the rest of the agenda. So I wanted to include this slide as a refresher. You might have seen it a few times in the beginning, a refresher of the aspects of our tobacco control work plan that we will be working on within this coalition. So the 4 priority areas are in blue, and the specific indicators we do work under are in green. So the first one is to decrease Indiana youth and young adult tobacco use rates. And we'll do this by working on middle school and high school prevention, youth empowerment, or our VOICE program, as well as point of sale tobacco marketing. Our second one is decreasing Indiana adult smoking rates. We'll do this by utilizing and promoting the Indiana Tobacco Quit line. We'll promote that to healthcare providers as well as employers and organizations. It's a free tobacco cessation program for Indiana residents. And it's web-based and phone-based. And then we also want to work on increasing the proportion of Hoosiers not exposed to secondhand smoke. So we'll do this by working on tobacco-free work sites. So making sure all workplaces are protected from secondhand smoke. And that's also including our smoke-free air policy and trying to get movement on that in our county. We're also working on tobacco-free schools, which is just reaching out to the schools, making sure they, if they need assistance with their tobacco-free grounds policy and anything related to that, we will help them. And then our tobacco-free multi-unit housing. So reaching out to the apartments and other multi-unit housing to make sure that they have resources for tobacco cessation, and also if they need help with any tobacco-free policies as well. And then our final priority area is maintaining a state and local infrastructure necessary to lower tobacco use rates. So that consists of this coalition here. So just gathering those passionate people willing to help make a change in terms of tobacco control here in our community. as well as marginalized populations. So making sure our most vulnerable populations are being served and that they are also on the table here. And then our tobacco-free families, which is we would train other organizations to on the Breathe Healthy Steps to Living tobacco-free program, which then they can utilize that program to educate their families on how to live tobacco-free lifestyles. So that is everything we're working on, all in a nutshell here. So I just wanted to refresh you all on that. And then I also wanted to also bring up that we are trying to create those subcommittees for this coalition. So we have the 4 subcommittees on the left. So youth prevention empowerment, smoke-free air policy, tobacco cessation, and recruitment and diversity and inclusion. So we wanted to create these subcommittees to help us be more effective and action-oriented in the work that we do. And on the right side are some general expectations of these subcommittees. So time commitment of 1.5 to 2 hours per month. Just actively participate at meetings, willing to take on tasks and offer ideas. And responsibilities will be shared. No one will have to take on one large task themselves. And it will be led by me until they're established. As of right now, we have 1 to 2 interested people for each of these subcommittees. So that's a great start, but we'd love to get more. And then we will be celebrating all successes, big and small. So if you are interested in joining these coalitions or these subcommittees, please let me know. And let's get into deliverable progress now. So in the last meeting, I listed some upcoming deliverables and ways you all could help. So these are some updates on that. So for tobacco-free schools, the state is starting to track tobacco-free grounds policies in Indiana schools. So I asked you all in the last meeting if you had connections with New Prairie School District, and Health Link helped us make that connection. So thank you to Liz and Hannah. We secured one tobacco-free policy from their New Prairie's superintendent. And I'm still in communication with LaPorte Community School Corporation, as well as Michigan City area schools as well. But if anyone has connections with Tri-Township Consolidated School Corporation, as well as MSD of New Durham Township and South Central Community School Corp, please let me know. I'd love to build connections with them. And then once we have access to these policies, we can analyze them and see if we can better support the schools in any way with their tobacco control strategies. And then for tobacco-free work sites or our smoke-free air policy indicator, I updated you in the last meeting about our small but successful community readiness profile walkthrough of the document. As a reminder, that document has a bunch of questions we answer about our community to gauge our community's readiness to go fully smoke-free. And so we filled that out the best that we could at the time, but it is a living document, so we're always going to be updating it along the way. And so I'll make sure to share that info again in the follow-up email. And so right now we're waiting on for training from the state on how to use our community readiness profile to build a strategy. So in the meantime, we discussed creating an opinion poll so that we can gauge the community's pulse on smoke-free air. And that'll even help refine our community readiness profile even more and help us kind of pinpoint where we want to start with these efforts. So as surveys can get expensive depending on the number of respondents, I wanted to ask the group about good and affordable survey platforms. So please let me know if you know of any, if you've done any in the past that have worked really well and you had a lot of responses. And then for point of sale tobacco marketing, in the last meeting, I explained the biennial tobacco retail environment assessments. And I provided you with some data from the 2020 assessments we did here in LaPorte County. And I also asked for volunteers for this year's assessments. We now have 8 volunteers, and there are around 120 retail environments that we have to assess. And I have actually more on the next slide on that. So for upcoming deliverables, I wanted to highlight this one as the major one, as it's starting in just a few weeks, and it runs till April 1st. So I'll explain again briefly for those who weren't on the last call. So these retail assessments we do every 2 years. We go out, the state provides us with a randomly selected list of tobacco retailers in our area. And this year we have around 120. I haven't received the finalized list yet. So what will happen is we'll break down the list, and I'll give each volunteer a few to visit. And then you'll have a list of questions to answer about the exterior advertisements, the interior advertisements, promotions, products, things like that. And then we will collect all that data and hopefully have some really great information to share with our community and local decision makers to show like, hey, this is a problem in our area. So, but it's very flexible. You can do the assessments between February and April at your convenience. There's no set structure to this. So if you are interested in volunteering, please let me know, as there's only 8 volunteers and we have 120 places to visit and assess. There is a virtual training just to teach us on best practices on how to do these assessments, but it is fairly simple. And that's Thursday, February 3rd from 10 to 11:30, and I'll make sure to send out the registration link to you all. And also, if you can share our volunteer recruitment flyer with your network so that we can get as many volunteers as possible, that would be great. Let's see here. Okay, so now we're moving on to resource sharing. So there is a lot on this page, so I'm going to briefly explain these to you all. But I figured they'd be really great resources to share. Here, the first one is the Pick Quit campaign. So the Indiana Tobacco Quit Line is running a campaign called Pick Quit through February 27th. So for the next month, it focuses on the Quit Line's individual services, which is super flexible. So instead of a tobacco user having to go through a fully structured 5-service program, instead of that, individual services, they can select from a list of services. They can just get the free nicotine replacement therapy if they want just that. They can also do the texting program if they want both of them. So it's very flexible. So that's the campaign, and you can leverage that campaign, share it with your networks. I'll send out some more information on it and some graphics that you can use. And then the Indiana Department of Health also recently launched a Behind the Haze campaign, which utilizes Instagram, YouTube, and Facebook, and has digital and printable materials that I'll send out to you. But it's focused on educating young people 13 to 21 years old on the unseen damage vaping does to their lungs on a cellular level. So this damage can affect even the strongest teens, leaving them with weak and vulnerable to viruses like flu, pneumonia, etc. And the campaign uses colorful overlays on relatable scenarios. So it's it's a really great campaign that you can leverage, especially if you work with youth or in a school setting or youth serving setting. And I'll make sure you have that info. And then the state also has a Vape Free Indiana site. And I've shared this a few times in some emails, but I wanted to bring it to your attention again, as it's a really helpful site, especially to educate others on vaping. It has really great information and resources, not just for teens, but also for parents, healthcare professionals, and educators. And what's really great is you can subscribe to their newsletter. So you click on the website and there'll be a link to subscribe, and I'll make sure you get sent that info. And then they'll send you regular updates with all their latest announcements. And then the state also came out with a new fact sheet on smoking and respiratory infections, including COVID-19. So that could really be a really great health education piece for you to send out as well. And then there is an Ask, Advise, Refer training that's focused on mental health and quitline and tobacco cessation methods. So I will send that out to you as well. And finally, there's an Ending the Silence training, which is all about if you work with youth who are struggling with mental health conditions, it'll teach you how to work with them even better. So it's a really great training, and I will send you all the dates and links to all this information. And then there's some 3 really great reads listed below. So Broken Promises to Our Children report. It's all about the original tobacco master settlements and how, you know, the nation got so much money to use on tobacco prevention and cessation, but it's not even really being used at all, just a little bit. So it kind of talks about that. And then along with that, the American Lung Association's State of Tobacco Control 2022 came out as well. And they also talk about the state of tobacco control throughout the nation and how Indiana is pretty much rated an F in majority of their grade categories for tobacco control. So it's a really interesting read, and we can really learn a lot about how to improve on that. And then there's the Big Tobacco's Latest Disguise. And that's a really interesting read as well, and I'll make sure to give you that information. So that is all the great resources I have for you. Feel free to use them as you need. And then I just want to end this with some action items. If you can get these back to me by February 9th. If you're able to help with these, that's amazing. So if you want to join our coalition, please let me know, or our coalition subcommittees, please let me know. We also, if you have connections with those 3 school districts I had mentioned earlier, please let me know. And then also, if you have ideas on good survey platforms for getting a lot of responses for an opinion poll, please send that my way. And then please register to be a volunteer for our tobacco retail assessments. That would be amazing. And then if you can't volunteer, it would be awesome if you can at least share our recruitment flyer that I'll send out to you all after this, so that we can try to get more volunteers to help us. So those are all the action items I have. And that's everything on my end. Our next meeting will be Wednesday, February 23rd, same time. This was only a 30-minute meeting, so that's awesome. I give you a 30-minute gift. Unless anybody wants to share anything that maybe they came to mind throughout this coalition, feel free to use this opportunity. If you have questions, let me know. If not, feel free to hop off. I'll be on here for a few more minutes.
Thanks, Melina.
Of course.
Thank you. And you'll send us all of the information and the flyer and all that. And I did update my email address for you.
Wonderful. Yes, I will send that all out to you either the end of today or early tomorrow.
All right. Thank you.
Thanks, Melina.
Thank you.
Thank you.
Thank you, guys.
Thank you.
Of course.
So Melina, Liz has some connections. I'm just reading the chat. I'm assuming you take a picture of the chat or it saves with your meeting notes.
Yes, it saves, and I'll be able to view it. I'm looking at it now.
So they do have a new principal this year, and a new school nurse. So those are who usually coordinate outside community partners coming in to visit with kids and things like that. So I can definitely get you connected. And then also for Westville as well, we did several vaccine pop-up clinics there, so I can send an email.
Wonderful. Thank you, Liz.
You're welcome.
Melina, I added my email address because I do have a few questions. So
Sure.
I'll reach out to you sometime this week just to see where we stand for work one. I believe Irma was our contact person from the Michigan City office. And so therefore
Okay.
I will reach out to her to make sure what we've done in the past or what we're starting to do so that I can keep the ball rolling. So
Wonderful.
Yeah,
Thank you so
and
much.
Monica, I can hop off if you want to ask your questions now. I just was looking in the, I get excited about what's in the chat, so.
no, you don't have to hop off. I don't know what to ask yet, Shirley, so it's okay.
Okay, well, thank
Yeah.
you.
Yeah.
Perfect.
So it
Thank
was a pleasure
you.
meeting. Yes, I'll talk
Bye-bye.
to you all soon. Bye-bye.
Sounds good. Bye-bye.
I gotta find my bye-bye button. Wait a minute, Melina. I covered my
I'll go
screen.
ahead and end the meeting.
That's okay. I'm good.
Alrighty.